Hello everyone. Now I'm going to introduce you the effective population protection, or known as risk mitigation measures after SARS-CoV-2 pandemic started. The COVID-19 epidemic struck China at the end of 2019. It was first identified in December 2019 in Wuhan, China. WHO declared the pandemic on March 11, 2020. Currently, it accounts to 62.5 billion cases. Now we will focus on the measures that were applied by China's government in order to control the spread of the virus in the spreading period. These measures can be divided into three aspects. Risk communication takes the responsibility to timely inform the public of a new disease and eliminate the rumor. Treatment and care has an obligation to cure patients effectively. Contact tracing, quarantine, and isolation undertakes the function of preventing possible transmissions. These three aspects count in the early period of a pandemic, and we will discuss the several approaches. Risk communication is often referred to as the exchange of real-time information, advice, and opinions between experts and people facing threats to their health. The reason why we care about this issue can be divided into three aspects. The first one is to ensure people get early protection. In the early days of the epidemic, many people did not have enough protection that the epidemic would not reach them, so they did not make preparations, which led to their disease and even affect their families. The second one is to let people get early treatment. If you have fever, fatigue, or a dry cough, it does not mean you have been affected, but you still need to go to hospital to test for disease, because it can ensure you and your family's safety. What's more, it is essential to avoid adding burden to our city and the governments or the social system. Because under the call of the government, all people have been quarantined at home in China, effectively preventing further spread of the epidemic. When people's lives are guaranteed, the government can better take a series of measures to control the epidemic. The solution for how to prepare well for emergency are also essential. First, on a multifaceted basis, there is a need at the national level for a public health infrastructure capable of identifying, tracking, managing, and treating the cases. For example, according to the comprehensively improved CDC facilities equipment conditions in China, the implementation of each province at least one reached laboratory biosafety level 3, each level at least one reached laboratory biosafety level 2. The pathogens of infectious disease, health hazard factors, and the national hygiene standards to implement the required inspection detection ability. Among them, prefecture-level centers for disease control and prevention focus on improving laboratory testing capacity, upgrading laboratory equipment, and building capacity for biosafety protection. Secondly, for the hospital level, sufficient medical supplies should be ensured, and the distribution of stock should be reasonable, including the distribution of epidemic prevention supplies. Then, the infectious disease bed construction scale is needed to be completed for the emergency situation, and the government had to improve urban networks for treating infectious disease, expand the capacity of centralized treatment of the infectious patients, strengthen infrastructure construction and equipment upgrading. At the same time, for individuals, there should be an increased awareness of the disease, such as self-isolation after illness, temperature measurement, hospital notification, social distancing, and disinfection such as ultraviolet light or alcohol. In general, the urgent prevention and the control of epidemic needs to join the efforts of everyone. Good prevention in advance can guarantee the safety of citizens' lives and property to the greatest extent. So now let's focus on common media used for risk communication in China. The information was first emerging from the internet, including Weibo, Sina News, Baidu, and some other commonly used apps in China. According to the latest report in July 2014 from China Internet Network Information Center, that by the end of June 2014, there were 189 million mobile microblog users and 67.66 million active users. Then, news of numbers of suspected, confirmed, and dead are being shown in Alipay, WeChat, and other social media. However, some older people do not use such an app, and people from poorer areas who cannot afford a phone. Thus, later in January, the channels of communication have expanded from the software to televisions, from local channels to central channels, and to messages sent to every phone number. Gradually, every community will be informed, and the residents could either see the note posted on the gate of the door or a message sent to each house. There is no doubt that the risk communication greatly helped the majority of people to survive safely in the most difficult period, both physically and mentally. With good and proper risk communication, COVID-19 may avoid causing much more serious damage to the country and the world. So for this part, the importance of several measures of risk communication are illustrated. Risk communication is of significant importance because it has an obligation to inform the public of the new disease and eliminate the rumors. Now let's focus on treatment. SARS-CoV-2 is a type of beta coronavirus. The development of a SARS-CoV-2 caused pneumonia treatment with a high cure rate and reduced cure time is very beneficial to reduce the mortality rate and prevent the transmission of the disease. Because pneumonia caused by SARS-CoV-2 virus is a self-limiting disease to a greater extent, it mainly depends on the patient's own mentality and immunity. So it is necessary to determine what kinds of treatment the patient needs according to the patient's own physical quality or condition. And this can help the medical instruments and other physicians generate their maximum efficiency. The classification is very important. The first class is patients who did not show whether he or she was infected or symptoms are symptomatic, which is characterized by clinical laboratories showing little or no pneumonia symptoms. The second class is ordinary infected type patient. This type of patient usually shows a flu-like symptom. The symptom can be fever with body temperature higher than 37.8 Celsius, and respiratory symptoms such as runny nose and cough. Also, symptoms of pneumonia of rough classes like lesions on lungs can be seen by CT imaging. This is because the fluid such as immune cells and sputum accumulating in the lungs. Third class is severe type patients. The conditions are more complicated and serious. The symptoms could include shortness of breath with a breathing rate higher than 30 times a minute. The finger blood oxygen saturated is low, and clinical symptoms gradually aggravate. The above are all conditions for determining whether the patient is a severe patient. Fourth is critical type patient. These patients usually are in conditions of respiratory system failure, multi-organ failure, shock, mechanical ventilation required, and are need transfer to ICU for treatment. And there are also high-risk groups which needed to be taken care of more specifically. High-risk groups include such persons: persons with age over 65 years old, a person with other disease such as cerebrovascular disease, lung disease, also persons with immune system deficiency, and expectant mothers. So these persons must be treated more carefully. A complete system is needed for treatment methods and where all types of patients need to be placed. This can be seen in treatment protocols for COVID-19, which was published in February 2020 in China. For those asymptomatic patients and ordinary infected patients, the common treatment often applied on these populations, such as rest in bed, monitoring the blood routine, urine routine, and biochemical information. If possible, cytokine testing is feasible. Some other treatments like give effective oxygen therapy in time and antibacterial treatment to avoid infections of bacteria. The second treatment is antiviral drugs treatment. Several drugs can be applied for treating the patients. First is alpha interferon, which is synthesis signaling protein and interact with the receptor on the surrounding on the affected cells. Second is ribavirin, a guanosine analog used to stop viral RNA synthesis and viral mRNA capping. Third, albedo. It can prevent the contact between the virus and cell memory of the host cell. It can also induce host cell to produce interferon and stimulate humoral response and phagocytosis of macrophages. And chloroquine phosphate 5 is also a drug for stopping the viral RNA synthesis. Third treatment is glucocorticoid therapy. The glucocorticoid can help deregulate the organ functions and reduce the death rate caused by other diseases which are triggered by the virus. The fourth treatment is immunity therapy. Normally, it is injection of recovery plasma, injection of human immunoglobulin, and the amount of injection varies depending on the patient. On January 31, 2020, the concentrated treatment plan for severe patients with pneumonia infected by the COVID-19 is published in China. It has the definition of on the basis of symptomatic treatment for severe patients, actively carry out the life support, prevent organ damage, treat basic diseases, and actively prevent the treat complications diseases. It has 4 steps. First, severe and critical type patients should provide active oxygen therapy to maintain blood oxygen content about 90% and inhale oxygen through an oxygen storage mask. Second, patients who cannot improve by oxygen therapy should be treated with mechanical ventilation at time. Generally, non-invasive mechanical ventilation is preferred. If mechanical ventilation still fails to improve the patient's oxygenation, ECMO should be used. Third, if septic shock is considered, adequate fluid resuscitation is key treatment. Fourth, if necessary, tracheal suction can be performed to clean the lungs. So in conclusion, because there is a system that can classify patients, it is possible to ensure that medical equipment and physicians can achieve maximum efficiency. And all patients, even patients with suspected symptoms, will be actively treated. After the treatment of the patients, the confirmed and active cases will ultimately go down. Now let's focus on contact tracing, quarantine, and isolation. So this public health issue of COVID-19 became serious as the time progressed. Where this pandemic triggered, Wuhan City is one of the transportation junction in China, which means this city has a huge volume of people and traffic flow all the time. Meanwhile, Chinese people are preparing to celebrate the Spring Festival when pandemic started, just like Christmas in America. So crowds are everywhere. These two main factors, traffic flows and festival, made these outbreaks worse and hard to control. Because people gathered again and again, creating much more occasions for spreading the virus than any other times in the year. But people did not have an awareness of these diseases at first. Then the disease broke out. Now this disease is still bothering human beings across the world, and it is still a terrible mess. We will discuss some approaches that apply to this public health affair in China, and I believe some of these measures may help to provide some inspirations for other communities or countries to optimize their surveillance system and control the disease. First, contact tracing approach. This is the basic part of the surveillance system. The system needs to know the route map of suspected case and send quarantine requests for other people who are contacted with this suspected case. China's government built a database, and this database will draw a route map. Every citizen is asked to report their routine by filling a form before they are permitted to enter somewhere, such as a community, a supermarket, and an office building. Every piece of data will be collected. The form will be updated to the database and analyzed by computers, and the route map will be drawn automatically and available for healthcare providers and the government. However, every coin has two sides. From the route map drawing measure I mentioned before, the database will know where people live, where people work, even where people spend their leisure time. It is serious if these data are leaked and used for other purposes. This surveillance system is radical and may cause exacerbated stigmatization and public mistrust. Second measure is the isolation approach. The isolation approach is strict. In the first few days after the outbreak, cities are locked down and most people are required to stay home. Food and other essentials will be supplied by community volunteers. With the situation becoming better, the city is no longer locked down, but if people have ever contacted patients with COVID-19, they will ask to stay at home for 14 days. The mechanism of isolation approach is reducing the flow of people and making less gathering. It has a huge effectiveness because city lockdown can cut off the channel of transmission. And the third one is quarantine approach, which is strict for tourists. International tourists, regardless of nationality, need to pass the RT-PCR test. Once they arrive in China, they are asked to live in the designated hotel for isolation for 14 days, and this policy is implemented until now. For all the tourists, they need to report their body temperature to confirm health in advance. In this part, several mechanisms are introduced: digital data for contacting tracing, necessary control for quarantine and isolation. Meanwhile, their drawbacks are also included. These approaches may be not suitable for every community or society, but I believe some inspirations can be extracted from these measures and avoid most of their shortcomings. So in conclusion, the risk communications can help population understand the current situation. The treatment is necessary for patients in order to reduce the death rate and prevent the infections. And tracing the confirmed case can help the healthcare department getting more information and prevent the spread of disease. So that's all my presentation. Thanks for watching.